I've never felt better about where we're at. It's pretty well clear to me where the country's going under Obamacare and BernieCare. It's going into further bankruptcy. It's more decisions further away from where you live. And in 1996, we block granted money for welfare reform, and it worked like a charm. We put governors in charge of the program. We held them accountable. So here's the choice for America: socialism or federalism.
Very simple choice. That was Senator Lindsey Graham defending the health care bill he's working on with Senator Bill Cassidy. The very latest effort to repeal Obamacare comes as the Republican Party scrambles to get its agenda done by the end of the year. Joining us right now is Kentucky Republican Congressman Andy Barr here on set. Also with us is Rhode Island Democratic Congressman David Cicilline. Good to see you both. Thank you so much for joining us, gentlemen.
Good morning. Good to be here.
So what's your take on Lindsey Graham and Senator Cassidy's plan?
Well, I think it's a great thing that the Senate is still working before the September 30th deadline to send something back to the House. Of course, we took action in the House to address the increasing premiums, to deal with the skyrocketing costs associated with Obamacare and the declining choices. And these problems are not going away. And so I'm very optimistic that the American people will continue to put pressure on the Senate to deliver on our promise to repeal and replace Obamacare.
Congressman Cicilline, are you gonna agree to Lindsey Graham's plan?
No, I mean, sadly, the Republican proposal doesn't address any of the problems in the Affordable Care Act. This provides a huge tax cut to the richest Americans, makes deep cuts in Medicaid, doesn't require states to cover pre-existing conditions. This is, again, an ongoing effort to pay for a huge tax cut for people in this country who don't need it.
Well, wait
and
a
to
second.
Finance that
does
tax
it
cut
not cover pre-existing conditions, or does it put it on the state?
It does not require pre-existing conditions, and a report released yesterday that said that for some very serious conditions, people will face tens of thousands of dollars in additional premiums. So it doesn't require that pre-existing conditions be covered. It's a huge tax cut for the richest people in this country who don't need it, makes deep cuts to Medicaid, which cover nursing home care, individuals with disabilities, and the like. This is more of a trade-off. Let's finance a big, huge tax cut for the richest people in this country who don't need it in order to pay for that tax cut.
How is it a tax cut for the rich?
It's an $800 billion tax cut. And it's for people who don't need it. And to finance that tax cut, which is really driving this, they make deep cuts in health care to the rest of the American people. It's a terrible bill. We have to fight hard to defeat it. And it doesn't address any of the problems in the Affordable Care Act. We need to increase competition, drive down costs. There are things we can do. Make prescription drugs more affordable by letting the government negotiate discount prices.
How come you haven't done it yet? We've been hearing this for a long time. No competition. There's one insurance company in so many states.
We've put in these proposals. We're not in the majority. We have a lot of good ideas of ways we can drive down costs, increase competition, make prescription drugs more affordable.
Barr, you're going to jump in here?
Party won't bring those forward.
Obamacare is the problem. Obamacare is the law that's denying the American people choices and competition. Obamacare is the law that's driving up cost. And so, I respect
tell that to the millions of people who have health care now.
I respect my colleague, but the bottom line is I trust the state of Kentucky. I trust our governors. I trust our states. I trust federalism. And so I would just say, look, let's put power back in the hands of our leadership in the state governments who are closer to the people, who know the particular needs of their unique and vulnerable populations. I trust them to craft and customize Medicaid in a much better way than a one-size-fits-all bureaucrat government
policy from Washington. It's not a one-size-fits-all. And tell that to the millions and millions of Americans before the Affordable Care Act who didn't have insurance, who couldn't afford insurance,
who are now facing double-digit increases, who are now facing double-digit increases in their premiums.
And we ought to be focused on bringing down costs, increasing competition, making prescription drugs more affordable. There are lots of things we can do working together in a bipartisan way to drive down the cost of health care. But repealing the Affordable Care Act fundamentally and providing it in order to finance a huge tax cut, making deep cuts in Medicaid and nursing home care for our seniors, for the most vulnerable populations, is not the right approach. It's why